didn't think I was going to get that one. To answer your question earlier, you said you noticed that when you go to stand up, it's harder, right? And part of what you're doing, for everybody at home that's watching, when you go to stand up, the weight of our spine is being transferred from the discs, which are the cartilage that's non-sensitive on the front side. Now when we're standing, we have to actually load the joints. So the knuckles in our spine, which are very sensitive, now have to hold weight, which is where the weight of our body should be. And so that's why we feel, and that's why we tend to, as people age, not do that. So do you see what the person that's bent forward? They're still sitting.
Yeah.
Right? There's not much difference. They're just still sitting while they're standing, right? And that's because God made our spine with the half the spine, particularly the back half, has all the feeling, and the front half has no feeling. And what you said 10 years ago, they did neck surgery. The surgery is ultimately usually because of these disc injuries. So the discs start to get displaced. The local pain is really the joint. And so the knuckles in your spine, if it was, terrible lower neck pain, fusing it will immobilize it. It's like a back brace, right? We can just immobilize the area where there's joint injury, and that'll make it feel better. The difficulty is that above or below the plate now has to do extra. So for the rest of your life going forward, we want to be as diligent as possible, making sure that the main engine of your spine, which is your atlas, they never perform surgery up here, by the way. All surgery, about 99% of the time, happens in the last 3 vertebrae in your lower neck. The upper neck is supposed to do the work, so you really shouldn't be able to injure this if this was functioning. So this must have been stiff going for 20 years before your neck surgery. This was locked up, and that's where our world has really failed at healthcare. Our world fails at checking to see if the atlas is functioning to prevent this injury that they operated on from happening. The medical world, and most of the chiropractic world, I'm not blaming, all doctors are so zoomed in on the injured area that we can't see the problem, right? The source of the problem. You have to zoom out a little bit and go, oh, the only reason this got destroyed was because the main parts of the spine around the injured area aren't working properly. And so I really do healthcare in terms of, now we're sort of in illness care with you. We're going to try to stop future problems from happening, which you're sort of beginning to feel in your left arm. Why is that happening? Well, that's the nerves that leave your lower neck go to your shoulder, specifically the fifth cervical nerve goes to your shoulder. So there's some level of irritation still happening to that area. You never felt this symptom before the surgery.
No.
It's only since.
Correct.
So it's likely that C6 or C7, the guys below C5 were fused, and now the guy right above is getting upset. And so to take the pressure off of C5, we have to go back and fix the root cause, which is, this model does a really cool job of showing you how loose that joint should be.
Oh, okay.
45 degrees each way. See how the head turns on this round donut that sits on a pin. That's called the dens, and that's the second vertebrae, has a pin that goes up into the first vertebrae, and that's how you turn your neck. And there's no disc between the skull, or what we call occiput, and atlas, and there's no disc between atlas and axis. The first disc is right there below the second vertebrae. And so wherever there's a disc, there's a restriction. They don't turn too much, right? About 5 degrees, 5 to 8 degrees, you understand, occur in the lower neck per vertebrae, while the top guy is your main engine, right? And so if your main engine shut down, you're going to wear out your backup engines down here. This guy's meant to do your left and right turns while you're driving your car, right? Just come in here, you made 1,000 left and right turns. But how often you made a U-turn? Not often, right? Maybe once a month or a couple times a month you make a U-turn. This is meant for U-turns. So how did you wear out your U-turn area without wearing out your left and right turn area? This should be doing most of the work. And so therefore this must be shut down, but again, nobody checks. And why did it get shut down? Great question. That's because the head went forward, because of your life spending most of your time, and I'm here. I'm not painting ceilings, right? My work is primarily here. So the curve in the neck, we're supposed to have this natural arch. This curve goes straight. That unlocks the lower neck, that stiffens the upper neck, and then the work is transferred like a ladder to your lower neck because of the loss of arch. This arch is called a lordosis, and probably not a word your chiropractor
No,
mentioned.
not at all.
The
Not even close.
Burger King chiropractor, because I'm an orthodontist. I don't just do dental hygienist. I'm going to clean your spine today, but I also want to show you we have to get the teeth, we have to get the spine aimed back into the right alignment. Otherwise, chiropractic has a very temporary benefit, which is a common complaint, rightfully so, of chiropractic, where it's like, well, I felt better for a couple hours and thanks, Ed, but then it came right back. And that's true. It's absolutely true, guys. Unless you're changing posture, unless you're changing the alignment, if you're a mechanical, I know you're mechanical, the arch, actually, these vertebrae lock together. So you can't turn them. Do you get the idea? They're all stuck together when there's a curve in the neck. Does everybody get that? You can't wear it out. You have to first fan the sinuses. Now we can destroy them. Right? So the loss of curve happens first, then the destruction of your lower neck happened, then it pops out and I'm dying here. Well, it popped out because the alignment changed first. The work got transferred to an area that was only supposed to do a little bit of work, now is doing 5 times the work, and then understandably it gets injured. Today, what are you going to do today? How can you help me? How can chiropractic help me from here forward? We're going to teach you how to be diligent and how to check and how to feel this upper neck. Way up here, up in the upper neck, they all do surgery, down here because the upper neck is not working. Gotcha. So we're gonna go up here and feel how this atlas. It's going to be stiff. It has to be.
Well, you say that, and that makes sense to me because again, I'm at home. The times that I do when I'm at home and I'm sitting, all of a sudden I get a headache, and I feel it right where you pointed at, at that base.
It's clogged. So the headache is the suboccipital area being inflamed, lactic acid. The mobility of the tissue washes the tissue. So if it was moving properly, it would be rinsing itself out. It's tight, so the suboccipital nerves are getting inflamed, and that's giving you referral pain. That's what the headache is. It's a co-symptom of your lower neck getting overworked, is the upper neck is frozen, and then you're noticing, why am I getting so many easy headaches? It's congested up here.
Well, you say that because, again, we do have those at home.
Good.
My wife has bought a couple of those, so we have a couple of those at home. In the living room, in our bedroom. Our son has one in his room. Okay. Because, again, we've learned this where you need that curve.
So the only missing piece then is that, again, if the clay is hard, one of my worries and why I don't just get on QVC and sell Dental, why even have an office, just, hi, everybody, lay on this Dental. If this is all stiff and we put the Dental on it, it might not bend properly. And it actually might only bend where you're injured, right? So we got to be a little careful. As long as we don't notice, like if you get on the neck Dental and your arm starts to hurt worse, we got to not do it. Yeah. You're actually maybe overstressing the area above the surgery. It's like a piece of paper, right? If I, one second, get back here. To mess up your intake paperwork here. Right? So if I take this piece of paper and I fold it back and forth, don't tear it, I just filled that out. Right? I just made a crease in that spot, right? Now if I bend it, where is it going to want to bend?
Right, the crease.
I can't make it bend somewhere else. It's always going to want to bend in the crease that I've already formed, right? So if I keep doing this repetitively over and over again, where is it going to tear?
Right at the crease.
Right at the crease.
Yeah, overworked it.
And we can see those creases, despite people online trying to, we can see them on the skin.
Yeah. Right?
Where the skin is creasing is a superficial observation of where it's creasing underneath. And where do most people crease? Right? There's big neck creases. And you're right, it is supposed to bend here also, but you should see some evidence that it creases at the top also. Right? You shouldn't just see one sole crease in the lower neck because you're going to wear it out. So what's your solution, Dr. Ed? Make a new crease.
Yeah.
We're going to make a new crease so that now we're going to bend at a different place. And then look at that, the inflamed area isn't so inflamed because it's not doing all the work anymore. We've made a new crease. Let me just turn this way. Pain when you're standing there?
Yeah.
Right? Where was the most pain there?
Right here.
Okay, 1 second, let me feel.
Right there, yeah.
All right. So right about here?
A little lower.
A little lower, right there?
Right there.
Right, you're about L3, L4, right? So that's right around the area where all surgery happens. So the same story that your neck went through 10 years ago is going to repeat down here, right? So your middle back is supposed to feel Whoa, Ed.
Yeah.
That's really loose. Right? Get the idea?
That's better than
right?
mine, yeah.
Right? Now, if it's all stiff, if I'm all jacked and stiff in here, right? Oh, it's not bending anymore, right?
Yeah, that's
It's
me
all-
right there. That's me.
It's all stiff, so but I'm bending. Where is it bending?
Oh, yeah.
Right there.
That's exactly me.
And now we're going to grind that poor area. So how, again, going back to my piece of paper analogy, we have to, so I'm going to beat you up, right? Because we have to beat it up a little bit to make that new crease. So this is we're going to loosen up that area that I imagine is going to be pretty tight in here. We're going to leave this area alone, and we're going to move the stress to your middle back. I'm going to help you a little. Sit up for me. Take a deep breath. Head back. Exhale. I got you. Yeah, really tight there. Deep breath. I got you, buddy. It's okay. Just relax. I got you. There you go. Deep breath. Yeah. I got you. Exhale. Chin down. All right, yeah.
That was nice.
Yeah, so about maybe 7. There's 12 guys, 12 to 14 guys that I tried to move. Does that make sense?
Yep.
And about maybe half moved, but way too much resistance. Like, aren't you happy they cracked, Ed? Well, no, because I had to put too much force to get them to move, right? Like a piano. The piano key should go up and down with very little pressure. I shouldn't have to like step on it. Take a deep breath. I got you. Exhale. I got you. All right, breathe. Real easy. Not trying to go too hard on this one. That's okay. That's it. Okay. That's it. It's okay. The goal of this adjustment is to loosen this joint below the lower back, right? You told me, Ed, it's hurting here. Nobody, hopefully they didn't, you understand, adjust this.
No, they
we're,
didn't.
we're trying to adjust up here and here, right? Okay. Deep breath. Exhale. Good. And then below. Exhale. Okay, face up for me. Okay, on the back. All right, let's see how that. Oh, beautiful. Yeah, it's a little bit out to the right here. Yeah. Keep that shoulder down as best you can. I got you. I'm not going to hurt you. Real gentle. I got you. Let it go. Yeah. There you go. Same thing. Here we go. Very nice. You okay?
Yep.
Yeah, you're good. I'll get the idea how we leave that lower neck alone, right? Nobody touches your lower neck, obviously. If you have surgery down there, right? Nobody ever touches you, hopefully. Like, just like you told me earlier, everybody needs to know you've had that surgery in your neck, and hopefully they understand that that's a signal to leave it alone. Has anybody dug up here before? Not so much.
No, I mean, I have.
A little bit.
Myself.
Okay, good. So you've kind of been. You've noticed something's wrong up here.
Yeah.
Yeah, that's the headache source. And all right. Right there.
Yep.
Mm-hmm.
Yeah, I don't feel good at all.
I'm gonna clean this out. We'll do this more face down in a second, but that's what I got. Yeah. It's this guy right here. So when we're on the neck dental roll, we're going to be going sort of back and to the right will be our correction just for about a month or so. I want you to try to focus more pressure on this right side. Right there. There you go. This is the curve that your neck needs to have.
How do you feel my neck? Does it feel straight? Does it have a curve in it? What
No.
am I-
No, sir. Yeah, it's straight. It's probably reversed. It's probably going the opposite way, and that's what, again, accelerated the aging of your lower neck. The lower neck aged at twice the rate because it was doing twice the work, or 3 times or 4 times the work. The candle that burns twice as bright burns half as long. It's not a diseased candle. Okay. Shoulder down as best you can, I know. I got you. I'm not going to hurt you. What was that, Ed? Right? That was the same joint moving deeper. Okay? So it's like a sliding door, right? The first adjustment took it halfway. Get the idea? And the second one took the same thing and just fully closed it. Just let your chin gently go down. Not gently.
I heard down, I went for it. I heard go down, I went for it.
Take it easy. Let's take it easy. Hey, you heard my Lord? Like, I told him to take it easy on it. See if we can calm down some of these headaches. Yeah, right there. So I figured out a long time ago that you can just sort of comb the tissue and it rinses out the acidity or the soft tissue inflammation, bruising that accumulates in these tight areas. So this helps to deal with what I call the immeasurables. This is a component of pain that can't be quantified on a blood test or measured on an MRI, but it attributes to a great deal of the reason for why I'm feeling something. And then this is what leads patients to a very disgruntled place where it's like, oh, my MRI came back okay, and I'm dying here, right? Well, because we can't quantify everything. It's even your injury 10 years ago, the joint pain that you were experiencing isn't something we can really measure. But I was dying, Ed. I get it. Look straight forward for me, just gently. Yeah, right. So there's a crease up here, but the first, look down. See the first crease, slowly look up again, so everybody help me see. First crease forms right there, and then this guy starts to form. That's where most of your bending is happening, right there. And I bet you that's where the surgery, you understand, is inside in that valley. That's where your neck likes to bend, and we need it bending better and more up here in the upper neck. Yeah, this is all contracted over here, so this is what's keeping that left hip high is all this. This is all tighter on the left side, and so the work, this is where you're overstressing. But up here's the source, right here.
Yep.
Yep.
I feel it.
Yep. That's where it comes from. And, if the MRI would, that's what. It's difficult because until the disc hits the nerve, there really isn't much warning, like a cavity in a tooth, But your back really is on its way for the same story repeating itself, right? And that's our job today, is to guide you in preventing and not letting that happen. And you're not going to need it. We got to learn how to talk to your middle back, how to keep it functioning up here, not letting it lock down.
I mean, I'm sure if I do stretches for that, it'll help, right?
Absolutely, no, 100%. No, that's everything. Learning how to keep this part of your back bending. So when you're working all day, this part of your back is functioning alongside your lower back. And then maybe if you're doing a lot of lifting, we put a back brace on this.
I do,
right?
which I do.
Good. Well, that's part of how you made it this far. But it still won't, just because we're stiffening this doesn't unlock this, right? So we have to still be diligent in keeping this part of our back functioning. All right. I never felt that before, Ed. The elbow didn't look too bad on YouTube.
Yeah, that does not tickle. That hurts a lot.
It looked like a nice gentle. This guy's really trying to get my backbone in there.
Oh.
All right. Yeah. Okay. Here we go.
Whew, it's hot in here now. Boy.
Did you turn the air up in here or something,
Man.
man? One kind of little tip we can do is when you're driving, especially more than 20 minutes, we put something behind your back here.
Which I do.
Good. Because what we're trying to do is encourage this area to maintain some of the curve and also to stay loose so that all the work isn't just getting sent right down to your lower back.
Well, listen, on a daily basis, when I do go to work, round trip, I'm on the road for about 3 hours a day.
If I did what you're doing, my back would hurt, okay? You have a tough job. You just need a car mechanic, okay?
I do.
You need
I do.
somebody, you're doing a very athletic thing to your spine, and it's difficult as is. It's impossible without somebody, maintaining the engine so that it's tuned properly.
Which is the reason why I go to, as you call them, Burger King places to get some type of adjustment or relief.
I hear you. As long as we're not manipulating the lower back, that's my main worry. Is
I tell them not to
Good,
because it does
good.
hurt. So I ask for the drops.
I got
That's
you.
it.
Please don't touch his lower back. Everybody at home. It's like a cut on your skin, right? If you have a cut on your skin, it never helps the cut to go be digging your finger into the wound, right? When you go to stand up, you're basically saying, I have a wound in my lower back. And I'm putting weight on that wound and it's hurting. Yeah, I know. That's why it's pinching that left arm. Right there. I got you, yeah.
Man, I know that hurt that bad.
I know. It's all clogged right here. Part of what's also happening is because the upper neck is tight, you're actually making your upper back recruited. It's participating in turning your neck. That's part of why this is so sore up here, is that you're actually utilizing your upper back to help you turn your neck.
Yeah.
Larry King was my poster child for this, right? He turned with his chest, right? He couldn't just do this. He did that. He turned his, see, I'm using my thoracic cage to help me turn my neck because my neck can't move independently. And that's part of why this is so inflamed. Why is it so sore up here? When you do that elbow up here, why? Because you got it doing a job it wasn't meant to do. And it's not very happy about that.
Yeah, exactly when you were talking with the skeleton.
Yes, sir.
Talking about the top part,
Yes.
when you were talking about turning your neck, all the turns.
Yes,
Like,
sir.
yeah, I was going to say exactly what you just said right now was I had to turn my
Chest.
chest area to turn to
Right.
see traffic.
It's killing me up here. I bet it is. It's doing a job it was never meant to do because your atlas is not working properly. That's really all the problem is, and almost even the reason why this exists, it really goes back to a domino from this. This gets stiff, that takes the curve out of your neck. That makes your head go forward. The head goes forward, this middle back gets tight, the middle back gets tight, now the lower back gets abused. Lower back gets abused, the hips become unlevel. Now your knee and your ankle. The whole thing is, the first domino is the atlas tightening from forward head posture.
So you're saying I'm a mess.
That's right. Welcome to the club. Yeah, I would, if you were here in Sarasota, I would actually I wouldn't do the side posture actually. I would, when you go to another chiropractor, I have no confidence. I wanted to examine you today, right? But I have no confidence that when I was doing that twist, that this was probably doing all the motion, right?
Yeah.
I want this joint to move, but it's so stiff that just this guy's moving. So I would almost spend a handful of visits just deep tissue working on this joint to get it to move independently, and then we could start safely doing that side posture. There is benefit to it, but not at the cost of further aggravating this.
Gotcha.
Okay, so just be careful when you're out there getting worked on. If you feel like this is moving too much, that adjustment isn't good for you. Guy's elbow like a scalpel, man. That goes right. Yep. I got you. There we go. Mm-hmm. Come on, bud. Breathe. Oh. You didn't think I was going to get that one.
No.
I think he was going to leave it there. Yeah. Unlocking that is really going to be our goal, that it won't be so stiff that you can do that yourself on the den roll. That, I don't know if we can right now. You might need a few more adjustments, but that would be your goal, that you can unlock that yourself and not need an hour massage, and that you can use your own body weight. And nobody ever goes down here. Right? Leave that alone. Notice I think you forgot an area, Ed. No.
Yeah, I was gonna say.
I know I purposely left it alone, right? It can't be helped by, there's cuts and wounds down there. We're spending time up here. Yeah, this just needs time. Sitting locks this joint. So 3 hours a day you're driving, that's the main culprit. It's like telling a dental hygienist you grind your teeth for 3 hours a day, right? It's like, they're not gonna be very happy with that. All right, what I'd like you to do, we're not gonna go, I don't want you to sit up yet, we're gonna roll onto your back. All right, so just take your time, just roll flat onto your back if you can, without getting up. Just, if you can just roll. I want to let the joints open up before we go to stand up, so I just want you to roll onto your back. Go slow. Yep, just lay flat on your back for a second. There you go. All right. There's a principle you need to understand of when we're laying on our belly, the joints are under more pressure. Do you follow me?
Yep.
So if you go to try to get up after being on your belly, like look at me for a second if you can. Stay there. If you're on your belly for a while, this is a good position for your back. But if you go to get up quickly after being on your back, you might, can't can't do it, Ed, right? Because the joints are compressed too much. Now, it doesn't mean you hurt anything, but we have to open the joint a little bit to put weight on the joint. That's what you're doing right now. You roll onto your back for about a minute or two, and you'll be able to then roll to your side and get up just fine. But sometimes people take that and sit and then think, oh, laying on my belly made it worse, or it hurt me, and it's not, assuming that you're not only just bending in the lower back. If all the bending's happening at the bottom, then yes, laying on your belly isn't good for you. But if the back's moving as a team, laying on your belly is not going to hurt you, okay? And this would be a good position if you're on a phone call or you're at home or whatever. You're not just sitting on the couch with your feet up on the coffee table. You're standing rounded forward. That would not be good for your back. Kind of idea. You want to be laying down, either be upright or laying down. Anytime you sit rounded forward, the stress is going right down to that area. Oh yeah. Let it go. Okay. Come on. Okay, fine. Let it go, Ed. Oh, nice. Okay, yeah. Yeah, he has too much weight on the toes here. Uh-huh. So your toes are jammed because the weight of the spine, weight of the body, wow, should be on the heel, right? But the weight is here. That's why these are starting to hammer, right? The drop metatarsals are happening. Your weight throughout your work is always on the pad of your foot.
Yep.
And so that's jamming the phalange with the metatarsal. And they call it metatarsal drop or bunion. There's going to be pain inside here or plantar fasciitis, right? The weight of your body belongs here. It's not here because your body's rounded forward. It's going to be right in here. From the connection between these two joints, there's a shearing force being placed on this joint because this joint's not meant to hold weight all the time. It's supposed to be on your heel. So the health care is to not keep going down this road, but to stop you. And then I'm worried about how sore is it? And
If anything, for my feet, it's my toes.
it's always the toes.
Yeah, they're more flat.
Okay.
And
all right.
I do feel them numb at times.
That's the lower back still. That'd be just the lower back, but not too sore in here yet.
No.
Yet. I'm just saying it's going to happen. This fascia is going to get upset. The more the weight goes here, it pulls on this fabric on the bottom of your foot. We call that plantar fasciitis, is the inflammation of this pad here. And the correction is to work on stretching the top of the foot. All right, I'm going to stretch all of this. I got you, buddy. Whoa. All right. So that's where it's all clogged. But like I said, you're using your upper back here. That's why that's all inflamed. That's why it's even more inflamed there's your two creases. Right, so there's a crease up here, but that's your deepest valley. That's where that area, and maybe even the plate is limiting. That's why it's starting to bend up here, which is good, but you got it all inflamed in the lower neck. And then that middle back is where we got to focus. Hand around your hip for me. Here we go. And then press back with your elbow into my elbow. There you go. There you go, nice.
That was easy. That was easy.
That was easy.
Oh, the rest of them like that.
Look straight forward. I got you. All right. Go ahead and tilt your head right for me a little bit. Just tilt so you're going to take your head and just tilt it to the right. Give me 1 second. Keep your head straight for a second. Okay, 1 second. Okay, go ahead. Go ahead. Okay. You're a good sport. Popping my ears. Gotta get the whole package.
I had that as a little kid.
Go ahead and left. And then go ahead and tilt left. Okay, it's okay. Come on, right over here.
When your mom?
Yeah, exactly that.
All right, so our goal is I don't want this down in the lower neck. So this would be relaxed. I'm going to show you where not to put it. So this is too low. See, we're in the lower neck. I don't want it so high, lay back, I'm showing you the wrong positions. I don't want it so high your chin's down. kind of want it middle upper neck. You'll take your hand, press, and we try to push the head in. It might slide down a little bit, but notice how it's contacting the upper neck, right? We're trying to maintain that fold of the upper neck. You press, and then see if your head will stay there, and you bring your hand back down and relax, okay? That is your goal. Now, its effectiveness is not as beneficial when your neck is stiff. Again, why have a job, right? So, Ed, it doesn't feel like it's doing much. Correct. You have to get adjusted, get your spine limber so that this works. It does have some benefit, but the more you're adjusted, the more the upper neck is working properly, the greater the benefit of the stretch and your time that you invest on this. Okay. But that is, you're actually, you're good, you're fine. So, and then you can only do a little bit of right rotation. Work on that knot. You understand? Maybe even use your right hand. Get the idea?
Yeah, push
and you
down.
work on that right side. Feel that knot up there?
Yeah.
You want to work that. Again, as long as it's upsetting the upper neck, thumbs up. But if it starts upsetting your shoulder or the lower neck, stop. I don't like, Ed, my shoulder's getting tingly while I'm doing it. Stop.
For how long do you recommend?
20 minutes.
20
So
minutes,
20 minutes is the required time to change the ligament laxity. So to actually change posture, we need to approach 20 minutes, and this is meant to be used in intervals of 20 minutes. Come on, easy.
All the way
Easy.
back? Okay.
Yep, that's good right there. Knees bent. I want you to put some stuff behind your head, okay? I don't need to kill your dad, okay? But we need time. If you did, I did it 2 minutes at full depth. Okay, that's great, but you're not going to get as much benefit as doing it at a lesser depth for a longer period of time, okay? You catch me, right?
Yeah.
All right, so I need time, and then we can always remove these books behind your head and make it more painful and make it more difficult, okay? But I want you to first get to 20 minutes, make it easy, make it feel like you're not doing anything. Then measure how much you put behind your head and then start making it smaller, okay?
Okay.
The difficulty of this will determine how often you need to be cared for. If you can progress on this, have at it. Don't need a chiropractor. If you can master where it's placed right now for 20 minutes and get your head on the floor, you've made it. The pain that you're describing in your lower back isn't possible if you can do this easily. You follow me? Because two things have to be true for your head to be on the floor. One, your back has to be curved. And if it's curved, the weight of your spine is evenly distributed. So you're not going to be able to injure one area if there's an arch in your back. In order for you to injure the area that you pointed to when you were sitting, there's no curve in your back. There has to be no curve. Hence, there can't be when you're sitting anyway. You follow me?
Yeah.
So all the weight is going right down to that area, and then you go to stand up and you're trying to put weight on that joint, and it's saying, no, thank you. And also has to be flexible. So if your back is flexible, then you can do this for 20 minutes. If it's all stiff, then it's really painful. And then rotate your knees to a side, pick a side, yeah, breathe, yeah. Oh yeah, stretch, put the arms to the side. There you go. And then knees left, knees back up, and then go left with them, move your feet to the right a little bit. There you go, and stretch. Oh. Mm-hmm. Got work to do.
Yeah, I do.
Okay, this is your job. Then knees back in the middle and take a break. Knees, and get ready for the next round. And just, oh, this is terrible. It also is going to help you when it comes time to get off, because I cannot have you doing a sit-up off this. I need you rolling to your side, and this knee side to side will make it more manageable when it comes time to get off and not call me, help! I need a forklift to get me off this thing. Okay, you're going to be able to do it yourself. I promise you're not going to hurt anything. It's going to hurt to get off, but you're not going to hurt anything, okay? The middle back is under functioning. It's going to be a little upset as we unlock it and get it working the way it's supposed to.
Not getting, I mean, everything you're saying is right on point, because obviously I had it backwards. Like I said, my focus was on my lower back versus where right now where it should be. So I get you.
Yeah, you got to move. Yeah. My dad was injured by that kind of care when I was a kid. Chiropractors kept manipulating my dad down here, and they kept on putting more stress. So why do I do what I do? It's because of that hurting my father. It's not good. Don't do that, please. Leave that lower back alone. Even if my dad walked in, what I was talking about with the SI joint is what he's taught me. If you can't move that joint without upsetting the lower back joints, you can't even do that good adjustment. We got to be careful about not upsetting where your back is already bending too much. All right, let's roll to your side. Roll to your side. I got you. Come on. Now roll back on your back. Roll back on your back. Yep. So you have two options. You either roll all the way to your belly, right? And then you roll back on your back. Give it a minute. Or you roll on your side, kick it out of the way, roll back on your back. Always give yourself about 30 seconds to a minute. before you get up. Let the joints open for a second after you just compressed it all. Let them open up a little bit, and then you'll be able to get up just fine. Shutting those drawers, you understand, they're gonna level out as you shut them. As you understand, because it not only goes out, but it also goes, you understand, crooked as it goes flexed.
And I feel lighter too, up there in my shoulders. I don't feel like I'm being pulled down. I feel, okay, yeah, this feels better.
Awesome, my friend.
Thank you, sir.
Yes, sir, thank you. All right, thank you guys.
You did great.
Awesome.